Hello everybody, thank you for joining my presentation. My name is Jared O'Connor, a Master of Public Health student at the University of New England. In conjunction with a literature-based evaluation of the Dracut Health Department's current public health emergency preparedness strategies, this presentation will serve as the second of two required projects to fulfill my applied practice experience within the MPH program. During this presentation, we will be discussing preparedness in action, strengthening Dracut's emergency plans with evidence-based frameworks. Before we begin, I would like to acknowledge the following for their collaboration and allowing me to participate in these projects. So a special thank you to the staff at the Dracut Health Department and UNE's Master of Public Health program. In this discussion, we will dive into the field of public health emergency preparedness, particularly within the context of Dracut, Massachusetts, and their health department. Findings of the previously discussed literature evaluation will be reviewed with a focus on improving the health department's current emergency management plans as they aim to revise their portfolio. These recommendations could have positive implications not only on the health department, but Dracut's population and community as a whole. Establishing an adaptable and community-based emergency preparedness framework will allow for an increased capacity for the department to respond effectively to any emergency they face, which will minimize negative health outcomes for Dracut. So the overall purpose of this will be an evaluation of Dracut's current public health emergency preparedness plans and to propose evidence-based improvements. Public health emergency preparedness is an interdisciplinary field focused on ensuring readiness, effective response, and the recovery from public health emergency events. As shown on this slide, it involves public health and healthcare systems, communities, and individuals, encapsulating the importance of interdisciplinary collaboration to keep populations safe. Public health emergencies can range from large-scale events such as pandemics, bioterrorist attacks, or environmental disasters, as well as more locally defined emergencies that can affect smaller communities. The introduction of this field in the United States was mainly due in part to the September 11th events and biomedical anthrax attacks shortly after, where the federal government invested $5 billion into the country's preparation and response infrastructure. This process is constantly in action even when a public health emergency is not present. This includes measuring performance capability in implementing corrective actions to improve and relies on multiple stakeholders, not just local health departments. In 2019, Johns Hopkins published a study ranking each nation's responsibilities during a public health emergency. This index ranked the United States at the top of the list in 5 out of 6 categories, with an overall score of 83.5 out of 100. 5 years removed since the beginning of the COVID-19 pandemic, evidence has shown just how ill-prepared the country who was thought of as the most prepared truly was. This unpreparedness was also evident in Dracut. Reviewing local data from the initial weeks of the pandemic can allow us to gain insights on what communities had better or worse responses. So from January 1st to April 29th, 2020, the state of Massachusetts had 60,265 confirmed COVID cases, equaling to a rate of 865 per 100,000. In the same time frame, Dracut saw 296 confirmed cases, with a case rate of 916 per 100,000. This reveals the rate of confirmed COVID cases in Dracut was slightly higher than the state rate of about 6%. And public health emergencies can also be confined to more localized communities or neighborhoods as seen in recent memory within Dracut. For example, in February of 2024, Dracut Public Schools had to cancel classes for a day due to a water main break on Lakeview Ave, disrupting water service to much of the town and flooding nearby homes. An interviewed contractor stated the water line that broke could date as far back as the early 1900s. Although the Dracut Fire Department and contractors responded to this situation swiftly, this event raises concerns about the resilience of town infrastructure and emergency preparedness. Events with similar impacts like this still fall under the classification of a public health emergency, and local agencies should be prepared to collaborate to mitigate significant impacts. Collaborative planning could look like the identification and updating of high-risk infrastructure and practicing emergency drills between municipal agencies and schools. Dracut's Public Health Emergency Preparedness Plan consists of two separate items: a locally designed emergency dispensing site, or EDS, action plan, and a binder containing NGO, state, and federal guidance for public health emergencies, which is called an After Action Report Improvement Plan, or AARIP. Starting with the EDS, this was most recently updated in 2019 before the onset of the pandemic. The plans outline guidance to coordinate in response to any natural or man-made public health emergency that will require an emergency dispensing site. These sites serve as locations where public health staff can distribute medications, vaccines, or other countermeasures to the public to prevent or mitigate the spread of disease and subsequently morbidity mortality. Instruction on how to open, operate, and close an EDS are detailed, with the idea of tailoring the plan to fit that event's circumstances. Now, switching to the After Action Report, this binder contains a wide variety of materials prepared by a public health consulting firm specifically for the Dracut Health Department. These materials range from fact sheets for disease agents and medications to checklists for implementing emergency dispensing sites and suggested supplies. A literature review identified two sources that set forth evaluation methods for public health emergency preparedness plans, along with assessments to assure readiness for local health departments. Beginning with evaluation methods, two assessment tools called the Rapid Urban Health Security Assessment and Public Health Emergency Management Evaluation Framework were used. Shown here is the Rapid Urban Health Security Assessment Tool. This tool is specifically designed for urban health departments to assess their capacity to respond to certain public health emergencies. The authors of this tool recognize that most emergency management and response plans are developed by national or state agencies and later adopted by local health departments. This is certainly a cost-effective route. However, these plans tend to follow a one-size-fits-all model, overlooking local capabilities to respond to emergencies. These generated plans are often left unread and stowed away by health department staff. Then, when they are needed, it is quickly realized that the plans are impractical to implement in the community during an actual emergency. To close this gap, this tool can evaluate local readiness and ability needed to prevent, detect, and respond to a public health threat within their community. It can structurally evaluate emergency plans while identifying strengths and areas for improvement. So 4 categories were developed in this tool, each consisting of different capacities and indicators. As shown on the left, these 4 categories are the ability to prevent, detect, and respond to public health emergencies, as well as some other considerations such as preparing for mass gathering events or chemical emergencies. Within these categories, 20 capacities are laid out, with each of those including a few indicators within them. A score of 1, 2, or 3 is given to each indicator, reflecting there is no capacity, a developed capacity, or a demonstrated capacity. Overall, this method can inform decision-making processes based on identified strengths and weaknesses in multiple public health emergency preparedness areas. The second identified evaluation tool was similarly designed due to the universal nature of public health emergency and response plans used by local health departments. The Public Health Emergency Management Evaluation Framework explores challenges at the local level in order to develop a standardized evaluation framework for current plans. 4 core domains are included in this framework, with each level containing different factors to evaluate readiness. So these include individual, organizational, overarching or cross-cutting, and overall implementation status. Using this framework allows for an analysis of comprehensive domains relevant in emergency preparedness. Highlighting weaknesses in an existing plan that may not appear until an emergency occurs will allow for proactive revisioning for any health department. These 2 evaluation frameworks were used to analyze Dracut's current plans critically in the literature review. Comparing the current plans to these frameworks allows for an understanding of strengths, gaps, and overall preparedness levels for any event. So beginning with the After Action Report, strengths of this plan can be attributed to the organizational theme of the Public Health Emergency Management Framework. It provides Dracut with essential resources to help the department understand and manage critical information during emergencies. This includes the factors of information sharing, planning and preparedness, delegation of roles and responsibilities, coordination, and legal policy framework. As for the more community-focused EDS plan, this document meets benchmarks in the organizational and overarching levels of the public health emergency management framework. All factors included in the organization level within the after action report are in this plan as well. Only the EDS plan is designed specifically for the Dracut community. So for example, it dives deeper into the logistical aspects needed to create and operate an emergency dispensing site. A concept of operations is included within the EDS, including different sections and phases needed to implement plans in Dracut. So here is a picture of Dracut's concept of operations within their EDS plan. As you follow along in the flowchart, the EDS binder actually contains materials for every word box and phase. So for example, as the town of Dracut implements these plans, flowcharts and images of the Richardson Middle School and Dracut Town Hall are provided to display makeshift clinics and vaccine dispensing sites. Having detailed plans like this pre-established allows the Dracut Health Department to streamline emergency operations, reduce response time, and build community familiarity within policies. Despite the strengths, there lies many opportunity for improvements for Dracut's emergency response and management plans. To begin, the after action report follows the previously mentioned one-size-fits-all approach for management plans. It provides the health department with valuable but very generalized guidance from a public health consulting firm. There is no community tailoring within these documents, which would not serve a valuable purpose when immediately needed. Both plans are also severely outdated. The after action report's publication date is from 2013, with many supporting materials dating as far back as 2005. As for the EDS plan, this was last revised in 2019, both before the COVID-19 pandemic. Other shortcomings include missing documents within both plans and incorrect contact information within the EDS. Lastly, there is a significant lack of guidance beyond EDS-related emergencies. While emergency dispensing sites are crucial for all emergency response plans, it is important to acknowledge the variety of other public health emergencies that can exist, even locally. To name a few, these include natural disasters, environmental hazards, bioterrorism events, chemical spills, and novel infectious diseases that may not have prophylactic measures. From the evaluation of Dracut's public health emergency preparedness portfolio, we can take away three findings. First, both the EDS and after action report provide the Dracut Health Department with valuable organizational planning techniques, such as resources to help staff understand and manage critical information during public health emergencies. However, the absence of stakeholder identification and emergency diversity within the plans limits its effectiveness when the department must coordinate with partners to mitigate impacts. And third, evaluation frameworks have repeatedly shown plans designed with a top-down or one-size-fits-all approach may not translate into effective responses when they need to be implemented. As the Dracut Health Department prepares to improve their preparedness portfolio, I also took some time to identify peer-reviewed best practices for public health emergency preparedness, planning, and development. One practice I want to mention here is the preparedness cycle. To prevent barriers faced in emergency plans that feature a top-down approach, the preparedness cycle is formed to always boost collaborative efforts between health departments and their stakeholders. This collaboration can be broken down into three phases: anticipation, response, and recovery. The preparedness cycle can be integrated into the design of emergency response plans to support the understanding of social, cultural, environmental, and political factors that have an impact on a community. Applying the preparedness cycle in Dracut will allow for open collaboration and communication between key stakeholders of the health department. This includes other governmental agencies within the town, local community public health organizations, and healthcare institutions, neighboring local health departments, and of course, the people of Dracut. Building relationships with these partners in the anticipation phase of the cycle will lead to greater preparedness in the event of a public health emergency. Next, using those stakeholders will allow the Dracut Health Department to identify, prioritize, and implement prevention strategies to mitigate risks and prevent emergencies. Using the water main break, for example, again, Identifying aging infrastructure within the town that could create disruptions and applying fixes is a proactive strategy that would prove to be cost effective and prevent unwanted consequences. Applying this framework to any scenario that poses a public health risk in Dracut can be extremely valuable. Analyzing any identified risk prior to it becoming an unwanted event utilizes a system thinking approach, especially when stakeholders work together to understand root causes, share resources, and implement coordinated solutions. Next, we will move into recommendations for improvement. One of the most immediate and critical actions the Dracut Health Department can take is to update and digitize its existing emergency preparedness documents. The current plans are outdated with some information dating back over a decade. Digital versions ensure easier access, faster updates, and better coordination across agencies during an emergency. Next, while the EDS plans provide strong logistical guidance for infectious disease response, it focuses too narrowly on biological threats. The department needs to broaden its preparedness scope to include chemical spills, natural disasters like flooding, and infrastructure threats. A more comprehensive plan ensures Dracut is prepared for a full range of emergencies. Third, we want to identify and engage stakeholders. Strong emergency response requires strong partnerships. The department should proactively identify key stakeholders, including schools, fire departments, healthcare partners, especially vulnerable populations, and involve them in both planning and response. Building these relationships ahead of time will improve trust, speed, and coordination during actual emergencies. And lastly, we recommend regular training and evaluation drills. Plans are only as good as the people who carry them out. Regular, realistic training, exercises, and evaluation drills are essential for ensuring the staff and partners are familiar with protocols and can execute them effectively under pressure. These drills should also be used to test gaps and continuously improve the plans. As we look ahead, the goal for Dracut should be to create a public health emergency preparedness plan that isn't just reactive, but adaptive, one that grows with the community's needs and remains relevant over time. This means moving away from static, outdated plans and towards a dynamic framework that can be regularly evaluated, updated, and implemented with input from local partners. The success by any emergency response plan depends on the trust of the people it serves. By prioritizing transparency, inclusion, and equity, specifically for vulnerable populations, the Dracut Health Department can strengthen its relationships with the community. Ultimately, this trust will translate into more effective communication, better resource coordination, and stronger health outcomes when emergencies arise. Thank you for taking the time to listen to my presentation. If you have any questions, feel free to reach out to me. Thank you.